3, 2, 1, go. So, good morning. My name is Muhammad Jamjum Sari, a second year medical student of Southwestern University, FINMA. Could you please state your name and your birth date for me, please?
My name is Muhammad Hawi Binar Sharif. My birth date is September 28, 2006.
Alright, so I think your mother who have consented this procedure have already told you about these assessments, I believe so?
Yes.
Alright, so do you consent on participating in this procedure or physical examination?
Yes.
Alright, so before we start, do you have any questions about this?
No.
None at all. So I will have to wash my hands first, and then ask you to please remove your shirt and then be placed in here for a comfortable position, lying position in this bed, examination bed. So please. Alright. So having this on a 30 degree angle, 30-degree angle elevated, I will now start with this. So basically what I will try to do here is to examine you for any abnormalities regarding your cardiovascular organ or system. So I will try to inspect for any abnormalities such as cyanosis and then clubbing. So for those, I will have to ask you to please, could you please raise your hands for me like this? Okay. So I am trying to look for any clubbing and then particularly cyanosis. And then could you please form a heart for me? Okay. So there is no clubbing and then symmetric with each other. Okay? Rest, please. Now could you please look upward? Now I'm trying to look for the conjunctiva for any pallor or paleness that would indicate anemia, but in this case it is normal. So first I'm going to assess your JVP or your jugular venous pressure or jugular vein pressure. So in the JVP, I will try to use my pen light in identifying for any distension. So could you please look for your left, please? Okay. So any obvious jugular distension that will indicate me in starting the procedure already. And then on the other side, please. However, usually we focus on the right jugular vein in order to measure the highest oscillation point of the right atrium. So in here, after looking at the tangential lighting, I would now be assessing and then identifying for your right jugular vein, specifically the external. So differing from your carotid, which is quite here, your external jugular vein would be at the attachment of the sternocleidomastoid. However, I will also be emphasizing the internal right jugular vein with its highest point. Alright? So, I will now be using ruler so that I can measure your JVP. Now, in measuring your JVP, I would be indicating it to the sternum and then the clavicle with the attachment of the sternocleidomastoid. So centimeter, ruler vertically and then horizontally, and then placing it at the aortic area. And then straight. Alright, so at least 2 centimeter. Your JVP is 2 centimeter as measured by the ruler, the vertical ruler, and that is normal since above 3 centimeter or more than 5 centimeters is already indicative of elevated JVP. So after identifying for your JVP, I would now have to identify for your highest point of pulsation in your right jugular vein. So that would include your carotid. So I will palpate your carotid. And then on the other side, please. Alright. So in palpation, I would be describing the diameter and then the amplitude. And then I would also be describing for any brutes or for any brutes, and then at the same time for any thrills. So those are the vibrations as alongside the palpation. I can feel any purring, the cat-like purring or vibrations that would indicate bruits or thrills, and that is abnormal. Alright, so that's it. To describe also your pulsation, grade 3 or 3 plus is brisk, and that is normal, alongside with all of your pulses. Now after your carotid, I would now proceed to making you lie into a left lateral decubitus position. Would that be okay with you?
Yes.
Okay, so please slightly turn to your left. Okay, exposing this one, exposing that one, and then I would now palpate for any hips and lifts. Now for the hips and lifts, I will be using my palm and then my finger pads as well as my thumb in feeling and then in palpating for any hips and lifts. Okay, so towards your apical pulse. Okay, so also for the thrills, I would also be using my finger, finger pad, my palm, specifically the bolts near to the wrist in identifying for any thrills. So please also say if this would make you painful, or if you would feel any tenderness. Is this painful?
No.
No. So I will be also looking for any thrills. Okay. Okay. So now I will be identifying for the PMI, or the point of maximal impulse. Now usually the point of maximal impulse is at the 5th intercostal space of the mid-clavicular line, and that would give me the mitral valve, exposing the mitral valve or the left ventricular area. For the left ventricular area, I would be using again the same manner I've used in identifying hips and lifts. So same as this. In comparison, up to the right ventricular area, and then to the pulmonic area, but excluding the aortic area. So since you have been presented as normal, the 5th intercostal space indicates the presence of your mitral valve, and that is your point of maximal impulse. Now, I'm identifying the point of maximal impulse. I would also be using my finger pads, my middle and then my index finger in palpating for your pulsations, or your pulse. So this would indicate me your 5th intercostal space, and that is your tricuspid valve, or mitral valve, and then lateral to the sternal border, and that is your mitral valve. And then at the 4th intercostal space, that would be your that would mean your tricuspid valve again. And then on the 3rd, and then on the 2nd intercostal space, left intercostal space, that would mean your pulmonic valve. And then just adjacent on the other side, at the right, the 2nd intercostal space, that would be your aortic valve, and that would mean your aortic pulsation. Now I would have uh, to use my stethoscope in order to hear for any crack of sound or any sound pertaining to your pulses. So first with the use of a diaphragm and later with the use of a bell. So same manner on the 15 intercostal space with clavicular line, I would be listening for the S1 and S2 or the loud dot, and any additional S3 or S4 would mean aortic regurgitation and other cardiovascular diseases locally. And then lateral, that is your tricuspid valve, fourth intercostal space, third intercostal space, and second intercostal space is your pulmonic valve, and on the other side is your aortic valve. Okay, so also in addition to the inspection, I would also have to look for any obvious distension, not just jugular distension, but also for any obvious heaves and lifts that would indicate an abnormality. So I would be lighting, so any obvious, and in this case it's normal. So could you please now lie back comfortably, just lie back, and then I will now be assessing palpating also for your other pulses, arterial pulses. So that would include, aside from your brachial pulse, here in line at the radial, so proceeding to the radial, so I with the use of my middle finger and then my index finger, so I will be palpating it here. So usually the brisk is 2, the grade is grade 3 or 3 plus, and that would indicate brisk, and that is normal since it is moderately loud. Moderately loud if I would be listening into the auscultation. So before proceeding to other pulses, I would have to perform already the Allen's test. So for the Allen's test, I would be I would be examining for your ulnar and then your radial. So could you please form a fist for me? And then I will include both the ulnar and the radial for quite a second. And could you please open? So it's already pale, it's already pale. And then I would have to unocclude the ulnar. And normally it should return into a pinkish, well perfused skin color that would indicate normal. So at least 3 to 5 seconds. So yours is normal. So after the Allen test, other pulses also that I would I would also be needing to assess is for the popliteal. So popliteal, just behind your knee joints. So here, and then 2 again, and then for 1 full minute, at least 12 to 20 beats per minute. And then the grade is brisk, which is 3 plus. And then aside from that, let's expose it to the video. The dorsalis pedis, I would also be looking for the dorsalis pedis, which is here. The pulsations of the dorsalis pedis, which the same grade must also be found. And then the posterior tibialis. Posterior tibialis would be here, beside. Okay, so just to inform you also that we have actually 1 to 6 grades of in describing the pulses. We have grade 1, 2, 3, 4, 5, 6. 1 is for very faint or very weak, almost almost cannot be detected, and then 2 is quiet, and then 3 is the normal, moderately loud, and then 4 is loud, while 5 and 6 is very loud. However, 6 is different from 5 since 6 is off chest but can still be heard, or can still be felt even off the stethoscope. So that would be it. Could you please sit up now so that you can relax, and then please put on your shirt. Alright, so please sit up now. And that's it for your cardiovascular physical examination. I hope you didn't find it discomforting. And then, do you have any questions again?
No.
None at all. So thank you very much, and see you again. Stay healthy.